We know that more than 40% of all patients with CLL express highly homologous B-cell receptor immunoglobulin genes. Those are called stereotyped, and patients expressing identical or quasi-identical BCRs are deemed to belong in the same stereotyped subset. Subset 2, in particular, is the largest stereotyped subset and represents 3% of all patients with CLL and 5.5% of all patients requiring treatment. The interesting part about subset 2 is that most of these patients have borderline IGHV mutational status. So we have mutated patients belonging to subset 2 with mutated CLL, and we have patients with unmutated CLL belonging to subset 2. So we know that this biomarker confers a shorter time to first treatment compared with other cases with mutated CLL. The remaining question is about the predictive value of this biomarker, and we know from a meta-analysis of randomized controlled studies that patients belonging to subset 2 have a shorter progression-free survival compared with other cases with mutated CLL when treated with chemotherapy and chemoimmunotherapy regimens. However, nowadays in chronic lymphocytic leukemia, chemoimmunotherapy starts to become obsolete. So the real question is if this biomarker has any predictive value in the era of targeted agents. And for this we have only a few data. We have data from the FLAIR trial where these patients had an excellent progression-free survival when treated with ibrutinib rituximab or the combination of ibrutinib and venetoclax. But we are talking only about a few patients, 20 patients in the ibrutinib rituximab arm and 13 patients in the ibrutinib venetoclax arm. In the last EHA, we had the PHILO group also presented a real-world study where they assessed the progression-free survival of patients belonging to subset 2 and treated with targeted agents. Most of the patients had received continuous BTKi treatment, and actually they had an excellent progression-free survival. But the problem is that we don't know if this biomarker has any impact on fixed duration treatments. And actually, ERIC, the European Research Initiative on CLL, has launched a new study that tries to assess exactly that. Because we know that this biomarker has a predictive value when patients treated with chemoimmunotherapy. So it's really interesting to see if this biomarker has any prognostic value in fixed duration treatment with targeted agents.